There's something special about St. Joe's. People tell us that when they walk into St. Joe's, it feels different from other health centers. They can't quite put the difference into words, but they tell stories. Stories about how a compassionate nurse supported them during a difficult time. How the delivery team shared their joy when their baby was born. Stories about the time a patient said, "Thank you," and made them realize they'd chosen the right career. St. Joe's difference can be put into one word: community. Our roots in community go back to the mission and values established by the Sisters of St. Joseph when the health center was built in 1921. It's the way our care teams work together in our patients' moments of need and in times of joy. It's the way we've been a part of our neighbors' lives for almost 100 years. And this sense of community is the driving force behind our vision for what St. Joe's can become in the years ahead. We're launching a new strategic plan that will be our roadmap, helping us to meet the needs of a rapidly changing population living in Toronto's West End by working together with our community and our partners. We're reaching beyond the walls of our health center and making a commitment to improve the health of our whole community, not just when patients come to us for care, but before they get sick, and making sure they have the right supports in place when they leave us to go home or to another care provider. That's why the time is right to launch a forward-thinking, outward-focused strategic plan guiding our work for the next 5 years. We've been talking a lot about the future lately. The conversations have been happening among our doctors, employees, students, and volunteers. We collaborated with our community partners and agencies, and we also asked for your input. We called over 800 of our neighbors for suggestions, and we worked closely with the Community Reference Panel, featuring representatives from across our surrounding neighborhoods, and held a public town hall. The outcome is a plan that reflects the wants and needs of people like you, our community.
So after almost 2 decades, we have a new vision: advancing the health of our community by being Canada's best community teaching health center. This vision will underpin our 3 strategic priorities: creating seamless transitions of care, delivering an exceptional experience, and shaping care through teaching and education. These include people, information management, physical space, financial stewardship, and partnerships. Both our new priorities and success factors are rooted in the conversations we've had with our community. So what does this plan mean for you as part of the important community? We will develop innovative approaches to what we call population health by proactively identifying specific patient populations that need more focused support to improve the health of the population as a whole. We will redefine the role of our emergency department as a community asset and connection points to services within and outside St. Joe's. And whether you're moving between areas at St. Joe's or leaving the health center for a community-based service, we'll be working to ensure you have a smooth transition. This network of care will also include connecting our patients to social services outside of the health center, because we know that safe, quality care shouldn't end when you leave St. Joe's. At the heart of our mission and values is you, our patients and families. We looked at our future from the perspective of patients and families' values and the need to meet the unique and diverse needs of each and every person we care for. It's all about personalizing healthcare, because we know patients are happier and healthier when they're involved in their care. Specifically, we will engage patients in the choices available to them and their families, make spiritual services available for everyone, communicate in a way that is meaningful to the person, and building clinical materials in a variety of languages beyond English and French to reflect West End Toronto's diverse populations. We'll also be enhancing services for our patients and their families' entire healthcare journey, including registration, food services, parking, signage, and common spaces. Overall, the patient experience will be central in all the work we do each and every day. The culture of teaching and learning at St. Joe's is rooted in our history, and we're building on it to meet the needs of modern patients and learners in 2015 and beyond. We will infuse every corner of St. Joe's with a culture of learning that ensures we're always on top of health innovations best practices, and emerging trends. We will be a leader in urban community-based education, something that would have a positive impact on the health of our entire community inside and outside our walls.
These three priorities are our focus as we look to 2020, but that doesn't mean our work is done. In the years ahead, we will continue the conversation we have started. We'll be seeking feedback from our community members like you, our patients, partners, and neighbors. And we'll be working hard behind the scenes to make our vision a reality. We're looking forward to 2015 and 2020 and the next 100 years of care at St. Joe's as we work towards advancing the health of the community by being Canada's best community teaching health centre.